So, with that, Dave Cooley has the first question.
Good evening. Um, my first question is actually not a question. It's a suggestion of something that one can do. In the chat, I put a PDF file that has a list of all the House and Senate Veteran Affairs Committee members' phone number contacts. And what I will tell you is you do what Bruce was saying earlier with regard to a letter. You say you call Senator so and so or Representative so and so, and you're going to be speaking to staff, but you're going to start off with saying, "I'm a veteran. I realize I'm not in the representative district or in the senator state, but nevertheless, Senator so-and-so represents me, or Representative so-and-so represents me because they are on the Veterans Affairs Committee and they represent all of us veterans." And I can tell you that it can work very well. I have, back when he was in office yet, contacted Senator Tester's office. And I actually got an email back from his attorney, and he wanted to set up an opportunity to speak with me directly on the telephone, the attorney for the Senate Veteran Affairs Committee. So we did set that up. So I want to tell you that you can reach out beyond just your state senators and your representative, but to the Veteran Affairs Committee's members. And that's a good place for you to put in your 2 cents worth about Section 302 of the Access Act. That that's going to be a bad thing for the VA and our care in future. Thank you very much. Appreciate it.
Thanks, David. All right, Jim Wolgamuth, here's my question to all three of the panelists. I know I go to the VA in Nashville, and they work side by side with Vanderbilt. And if the administration, abuses the VA to the extent that it shuts down, well, I guess get to the question, Jim. All right, are any of these university presidents or researchers standing up and saying, listen, you can't do this to the VA because we help train our doctors. When I had surgery, I had two or three VA doctors and three people looking on who were just medical students at Vanderbilt. I mean, if the VA goes away, doesn't that hurt colleges and universities? And are they stepping up? Are they trying to do anything? So, whoever wants to take that on.
Well, I can say a little bit about it, Jim. The VA has affiliations with virtually every medical school in the country, and then with all kinds of other institutions that provide healthcare training. And the Association of American Medical Colleges, name it, did write a letter to Congress saying that if the VA was done away with it, it'd have a severe impact on medical education. 70% of all doctors receive at least some of their training in a VA facility. And I worked at a couple of highly affiliated institutions, three of them, the Birmingham Hospital, the Lexington Hospital, and the Denver Hospital. And so many physicians have joint appointments. They work both at the VA and they work at the medical school. And so there's an interchange of patients there, and patients are sometimes, if at the VA, they'll be taken over to the medical school for some treatment, or the surgeons come back and forth. So the VA benefits greatly from that, as do the medical schools, but also as does the American public. I mean, if the VA went away, the training it provides for doctors, for nurses, for physical therapists, for occupational therapists, for all these people in the various healthcare professions, I don't know how that would be filled, and I think they're concerned about that. I don't know if they're doing enough about it, but it certainly is meaningful to them. It has strengthened the VA to have these affiliations. It has strengthened the U.S. healthcare system, and it has benefited the general public. One other point quickly, that these research things, Suzanne mentioned this without compensation appointments. Well, there are research programs that are funded by the VA or funded by other people, and there's sometimes joint research programs between university personnel and VA personnel. These without compensation appointments are people who are interested in doing the research, don't need to be paid for it, but they work on the projects, and it doesn't cost the VA anything. And initially, the VA canceled these. I mean, the VA research program is second only to the National Institutes of Health in its breadth and its scope, and it benefits everybody. It's not research on prosthetics, research on any condition that affects veterans, affects the general population. So that will also be lost if we do away with the research program. Suzanne or Russell might have something to say
Yeah,
about
let me
this.
just jump in briefly. So, Jim, I think one of your questions is how active are the medical schools? And Bruce was just mentioning the AAMC. From my perspective, AAMC has been lukewarm at best in terms of what they ought to be doing. And I don't know if anybody on this call has direct or indirect contact with them, but any way in which they can leverage their power around this, we ought to encourage that. You know, in my own contacts with them around the Access Act, which would be catastrophic for them, they just didn't. They have not weighed in on the Access Act. You know, and they basically punted. So I think we'd love to have kind of more of their concern when there are privatization bills that are going to be harmful to VAs. I think your question, Jim, also suggests what happens when a unit is closed down. You know, which when that happens, there's going to be no training on those units, and ultimately, what will disappear are some of the stipends that the VA pays in order to have training happening on those units. And this is going to eventually have kind of a pretty serious impact on many of the medical schools that Bruce was talking about in terms of reduced funding for training. I mean, that is going to be a long-term consequence of privatization of the VA and the closure of units and of hospitals.
I don't have anything to add to this. I mean, I think that the universities are, not, they should be weighing in more on the cuts to funding. And, I think that people are just too scared, and they should be less scared and should get their acts together and start speaking up. But I just want to make a comment that is kind of off this point, but we really need stories and people to talk to the media and talk to ourselves, and because if anybody who these cuts are impacting really needs to speak up, because people are asking us. I mean, I spend hours, Russell spends hours, Bruce spends hours talking to the media, and Bruce is a veteran, so he can talk about it, but Russell and I can't, because we're not governed by the VA, and they want to talk to veterans. So please be in contact with me and Russell. Tell this to your friends as well, and be on the lookout for this, because this is, again, how we're going to stop it.
All right. Thank you. Ken Dursa.
Yes, my name's Ken Dursa. I'm a member of the newly formed Labor Working Group of VFP, and I heard mention that you folks had worked with the American Federation of Government Employees about some of the reductions, and we've seen in checking out the postal workers website, they have what they call the home front, and the VA is a top concern. It has a red alert as their banner for the home front, and they have by the way, their labor history is incredible, and we just got a story up there for the last International Women's Day, and we robbed it from the postal workers, which is good stuff, and we'll get them on May Day. The question is this: and all the other major unions, because who fights the wars? The working people, and who is in the unions, but the working people, in a higher percentage of veterans than in other organizations. So how can we get something together, the synergy? And I'm sure they don't have a lot of staffing at some of the unions, and especially now that they're being the layoffs, there may even be staff reductions from the union staff. But how can we develop a synergy? Or these people already set up a committee with VFP to do the outreach and communication with the major unions, United Auto Workers, United Electrical Workers, etc. How can we develop that synergy? I don't have the expertise, but I'm sure that the major unions do.
Well, I think I can take that question, maybe Bruce or Russell. We've been working with the AFGE. It's not the most militant union on the face of the earth, but it's getting better. NEFI, there's some fabulous people in NEFI, National Federation of Federal Employees, and you should look up the Federal Unionist Network, which they've set up. And so, the one union that I haven't heard enough of is from the National Nurses United, and they don't seem to be able to work with anybody. But there is coordination suddenly with these unions. I wish we had more contact with the postal workers. The International Association of Machinists has a lot of veterans, and they have a veterans group. So, I think that probably for you all, the most productive thing is to just contact locals in your area. Sometimes AFG and NEFI nationally don't have enough contact with folks locally. So you can reach out to, find out what the local is in your area. You can reach out to the state feds, the AFL-CIO, and I'm going to go ask my husband, who spent 27 years working for CWA. In a second, I'll run out and ask him. But, I would suggest very much reaching out to your local groups, because sometimes there's a disconnect between national unions and their, and the locals. And the locals are really where the action is, and you can find out where there are demonstrations, and just keep your eye out, and also check out the FUN Federal Unionist Network website, and they'll let you know. I would also contact local healthcare reform groups, because they're very involved, should be more involved in this. They're very willing to be involved in it. And the same folks that are trying to kill Medicare and Medicaid are trying to kill the VA. And, the whole point here, I think, is that they want to get money for their tax cuts, and they can't fund, federal services and their tax cuts, right? It's just not possible. And so that's why they're doing all this, aside from their just animus and meanness and, whatever. But I think that, let me just go and ask my husband for some more suggestions, and you can, I know people have more questions.
All right. Well, while we're waiting on Suzanne to get back, Joe?
What I have is basically a comment. I work in hospitals in my working career as a union worker, and I'm also, of course, a veteran, and I'm in the Providence VA system. I have 8 appointments in the next 30 days. But in one of the hospitals that I worked in, it was a respiratory care facility that was basically financed by the tobacco industry. And their whole focus was to get as much Medicare money as they could from the patients. So you could see that's kind of a connection with the finances behind healthcare.
Thank you.
Oh, you're welcome.
Any comments from Russell or Bruce with regard to Joe's comment, or should we go on to Doug Rawlings?
Can I just make
Yeah.
a quick comment? So one of the things I didn't mention though is what we always look for if you have, particularly if you have a member of the House Veterans Affairs Committee is your representative, you're in that person's district, or if you live in a state where a senator is a member of the Senate Veterans Affairs Committee, we're always looking for a veteran who will join us in a Zoom call with these representatives, particularly if you've gotten care from the VA and you've had a good experience, or if you've gotten care from the community and not had a good experience. If we can get a veteran with us and we can arrange a Zoom call and we can talk probably one of the staffers and you can tell your story, and that can be pretty effective. But we usually need a person from the district or the state to be able to have a Zoom call. So if you're interested in that, you can contact us. That's all I had to say. Thanks.
All right. Thanks,
Um,
Bruce. All right. Oh,
I'm back.
Suzanne's back.
You should all go to the Federal Unionist Network. There's a thing that says join us, and you can sign up to be, get emails, and you can also, they have a thing that says events. The postal workers will be holding a lot of events and protests, and you can keep your eyes posted for those, and you can join them. That's a great way to make a contact, to show up at people's protests. And also you should reach out to the local AFL-CIO, your local labor councils, as well as the state feds. Those are just a couple of things that, ways to do this.
Thanks, Suzanne. Thanks, Suzanne. Doug Rawlings.
Yeah, thanks, Jim. One quick question and one suggested strategy, perhaps. The quick question is this: does anybody know if the VA is giving the concept of moral injury any serious consideration? It's a much more comprehensive idea, I think, than, say, PTSD or something like that. So I think that's worthy of looking at. The suggestion is that what we did in Veterans for Peace, when we found out that the Pentagon was trying to write a history of the Vietnam War, we put together a full disclosure program to sort of counter that. And part of that was asking anybody who was directly impacted by the Vietnam War, to write a letter to the wall, which we delivered on Memorial Day. We delivered over 500 letters. And I thought maybe it would be an interesting idea to have people write a letter, anybody who's directly impacted by what's happening at the VA. And on Veterans Day, go to the VA in Washington, D.C. and deliver thousands of letters in print, in envelopes. Anyways, just that idea and the moral injury concept.
And
Anybody
Doug, the short answer to your question is yes. Surprisingly, actually, the VA has been putting money into studying it for probably 15 years. The two VAs that are doing the most work at that are the Boston VA and the San Francisco VA. If you Googled moral injury and veterans, you'll find many studies and treatment protocols. And I actually think some of the people on this call have been through some of the protocols that the VA's developed, to their credit.
Thank you. And the book by Allison Staunton Lind, I think, is a very good resource as well on moral injury. So.
Very good. All right, Margaret Peoples.
I live in Charlotte. My husband started a chapter of Veterans for Peace when we lived in Raleigh. And that's still going, the Eisenhower chapter. And I think Vicki Ryder is pretty active in near Chapel Hill, keeping that going. I saw you were having this tonight, so I wanted to listen in. Our daughter works here in Charlotte as a remote worker for the CDC. So we all think she's going to be moved some other place. One thing I was wondering about, we lived in Arizona for many years when the children were very small, and we went to a lot of native land, the Hopis and the Navajos. And of course, when we lived in Oklahoma, we had lots of Cherokee land around us, even though it wasn't consolidated like a reservation, it was still Cherokee land. They're the Western tribe, obviously. who had to be forced out of North Carolina. But anyway, do they have veterans on the reservations, on the tribal lands that contact you guys?
I think they do. I mean, isn't that true? I mean, a lot of Native Americans are veterans. I mean, I'm not an expert on this, although I know that Paul Sullivan, who is part of our steering committee, is an expert on this. But I can't speak to it. But yes, there are many veterans who are on Indian lands. And of
I
course,
would
I
think
don't know what
they have very serious issues that make them not just veterans, but Indigenous people with poverty and mental issues. They need a lot of help. And, but Indian Health Service is there, but I wonder how much help they get as a veteran when they go to Indian Health Service on their own lands. I don't know, but if you think things are bad somewhere in our country, Indigenous land is always where it's been the worst.
Yep.
And I've lived there, for several years now, and I've seen it. It's rough.
Thanks, Margaret. Arla and John.
Yes, hi, John Wilkes and Arla Ertz, Albuquerque. Question: does this group, organization, etc., do you have a canned op-ed or letter to the editor which describes all of the benefit of the VA to non-veterans? The 300 trials going on with NIH, the training facility for interns and fellows, the strategic reserve for the public health service. It's my view that the public needs to know that if the VA is basically demolished, a real asset to the country is lost, not just veteran health care. Do we have such a document?
we have, if you go to our website, John, which I put up there, if you go to the website and you look up our work, I think there's a thing that says why the VA matters, and we have a series of fact sheets of topics we cover. It's under topics we cover, why the VA matters. I can put that in the chat, and there's a number of
Please.
fact sheets that will help you with that. And again, I know Veterans for Peace. Bruce could, has a number of things. We don't have a single op-ed right now on that issue, but if you contact us, we can help with that probably. But it would be a very long op-ed. One of the other things we didn't talk about, Amy Fairweather's on the phone, but is the impact on homelessness programs and homelessness nationally. If you look at, and Amy, maybe you should speak about this, but if they disappear the VA, veteran homelessness will skyrocket. I think it's safe to say, and that means homelessness in your area will increase.
Okay, thanks for that very much.
Denny Riley.
I was at some of the early meetings with Russell and Suzanne when they were decided they were going to be troublemakers. And so since then, I go to the VA a lot, and every time I have talked about the fact that this institution is going to be closed down if people don't do something about it. Everybody, volunteers all the way up to surgeons, and everybody was going, nobody took it. And sometimes they give me they give me Trump raps and stuff. At any rate, the thing about they would, and then a week after the election, I went over there. Some of those people were so sulky, because they realized what an error. But you don't say anything about it. The thing about Native Americans is that a bunch of us went up to North Dakota to stand with them against the pipeline, Nice talking to some young men on the reservation are not don't have great opportunity, but they were raised in a warrior culture, and so joining the Marines or whatever. If I think that most of us white guys, probably the first time we met an Indian was in the military. It's because that was what they could do, and it's devastating to anybody to join. You're not going to come back with a healthy head after that. Anyway, thank you.
And any comments with regard to what Denny just said, or we'll go right to David Cooley?
If any of you are thinking about writing op-eds or letters to the editor, things of that like that, there are all the kinds of things that Russell and Suzanne talk about that will go away normally with the VA disappearing. But there are lots of other things like the VSO travel to bring veterans to the clinics and mental health and medical centers. Those van systems are going to disappear. So how veterans are going to get to their elderly veterans, particularly from outstate areas, are going to get to healthcare, to multiple appointments all over cities or wherever they might possibly be, or even specialty care that won't even exist anymore is going to be gone. Another thing that's going to be gone is when you go to the VA, you enter a community, not just of veterans going there as patients. You go there, veterans as part of your providers. You go there with people who have dedicated their lives to perhaps not making quite as much money to care for veterans because they feel it's important. It's a real community. If you can't feel it, you're really missing something. Every time I go there, I just tell everybody, I love you. You are my heroes. We have to take care of one another, is what I say.
Thanks,
And
David.
thanks.
That's awesome. Ken, you can go, and then Phil, and that will be it.
Bill, go first.
Phil, I think he said go first.
Okay. I mean, it's just a quick question. I know the veteran service organizations, have done very little thus far. However, they're huge, right? Is there any way to reach them to try to organize them to get involved with any of this stuff?
I think that you should go to them at the local level, because people have said that at the local level, if you go to the Legion or the DAV or the VFW, at the local level, you can make more headway than at the national level. And forgive me for having forgotten to say that. So I think that that's a really good question and a good strategy. And I just wanted to say that we're preparing at BHPI a list of all the things that will disappear. I mean, obviously we can't put everything in there because it would be a phone book. But, some of the things like what David Cooley mentioned, the things that would disappear if VA would disappear. And Bruce and everybody at VASP will get that the minute we're finished with it, which should be shortly.
Thanks.
Thank you. All right. Thanks, Phil. And now Ken.
I just put it up on chat. Rose Roach from AFL-CIO. She works on single payer, and she's interested in working with VFP and other groups. She made a presentation to our labor working group, and she's fantastic. So I put her email address up there, and she's out of Minnesota, and she's interested in working on saving our VA.
Oh, that's helpful. Okay, so Suzanne, some last words?
I just think this is a great thing to be doing. I think we should be continuing to do this and just keeping, batting off the shit they throw at the wall because they're like schoolyard bullies and they collapse when there's enough pushback. I just learned, I'm sure you all know about it, that they took the website of the Black Congressional, the Pentagon Medal of Honor, winners or whatever, and people had a shit fit and then they put it back up, etc. So, and I would really, really encourage you to contact your Congress people, even if they're Dems. Some of the Democrats that I've talked to, the Democratic staff members are demoralized, and it's like, oh, they don't tell us anything, and we can't do anything, and we can't reach anybody, blah blah blah. And I think that we can't reach the Republicans, and I think in this instance, part of the Democratic opposition, we have to reinforce their spines, because in this case, preaching to the choir is very important, because the choir, you don't want the choir to be so demoralized that they don't come to the church to sing. And you need to give the choir new material, and you need to get more people in the choir. So don't hesitate to contact your Democratic representatives, as well as harass like hell, the Republicans. So I just think this is a great group. I think Veterans for Peace deserves such a huge shout out, because they have been there before anybody. The Save Our VA campaign, really, you are heroes, right? So I'm excited to be on here. I know that we would be anything we can do. If you want trainings, if you want whatever you want, we're available to you. And you keep us going.
That's wonderful, Suzanne. Thank you. All right. Russell.
Suzanne covered it all. We're grateful to have the opportunity to spend this time with you, to share kind of those things that we have learned in our years really researching and investigating. And we're happy to kind of continue the relationship that we have with you in the various ways, to keep feeding the material, the analyses that we do, the investigations we do, and to collaborate together, So thank you.
And now, Bruce, last word, man.
Well, what I want to say is people shouldn't get discouraged too early that it's like a movement in a sense. It's like the civil rights movement or the anti-war movement during Vietnam. It's not exactly the same thing, but there's kind of a groundswell against what the Trump administration is doing, not only to veterans benefits, but potentially to Medicare, to a USAID, to all the programs it has. And so people have to mobilize and not be discouraged. We're not going to defeat this in 2 weeks. It's a long-term project. You need to encourage people to get involved, to attend demonstrations, to contact their congressmen if they're involved in civic organizations, to get the civic organizations to lobby Congress about making these changes, and ask Congress to get a spine. They're supposed to have control of the purse. Ask Congress to have a spine and to stand up to the president. Anyway, I also want to join Russell and Suzanne in thanking you for having us. And we were happy to be able to do this, and we're certainly happy to do it again if there's a call for us to talk to people about the work of VHPI and the Save Our VA campaign.